Hi, my name is Professor Oliver Tobolski. I am a German orthopedic specialist, and today I would like to inform you about carpal tunnel syndrome surgery in Germany. Carpal tunnel syndrome is a condition of the hand that causes wrist pain, numbness and tingling from pressure on the median nerve in your wrist. Causes include certain illnesses, obesity and pregnancy. Surgery only becomes necessary in the most severe cases. Carpal tunnel syndrome is a medical condition that occurs when the median nerve, which runs from the forearm to the palm of the hand through the carpal tunnel, becomes compressed, which causes wrist pain, tingling and numbness. Causes for the condition vary greatly and include injuries to the wrist, rheumatoid arthritis and the mechanical problems in the wrist joint. Surgery, known as carpal tunnel release or carpal tunnel decompression, is usually recommended if the symptoms last longer than 6 months and other treatments have failed to relieve the pain. During the procedure, which can be done on an outpatient basis and does not require an overnight hospitality stay, the roof of the carpal tunnel, carpal ligament, is cut to reduce pressure on the median nerve in the wrist. Carpal tunnel surgery is one of the most common surgical procedures available. When is carpal tunnel syndrome surgery necessary? Surgery for carpal tunnel syndrome becomes necessary when the symptoms of the disease don't go away and no conservative treatment methods have shown to be sufficiently effective. When daily activities are affected by the symptoms of the condition, surgery should be considered. These symptoms include a persistent loss of feeling or coordination in the fingers or hand, a decrease in strength of the thumb and a loss of sleep due to the pain. Surgery becomes especially necessary when the median nerve is damaged, which can be determined by diagnostic nerve test and result in a loss of hand, thumb or finger function. German doctors will decide upon the best possible treatment of carpal tunnel syndrome on a case-by-case basis. Patients will be informed in detail about the risk and benefits of surgery in their particular case. How is carpal tunnel syndrome surgery performed? Carpal tunnel surgery is performed under local anesthesia and on an outpatient basis. Patients often require surgery on both hands. There are two common types of carpal tunnel release surgery: open release surgery and endoscopic surgery. Open release surgery is the traditional surgical option for the treatment of carpal tunnel syndrome, during which the doctor makes an incision in the wrist and then cuts the carpal ligament to enlarge the carpal tunnel. However, in Germany, in general, orthopedic surgeons prefer less invasive procedures such as endoscopic techniques, which reduce the rehabilitation period, prevent scarring and minimize postoperative pain and discomfort. 2 small incisions are made in the wrist and palm, where the surgeon inserts a camera attached to a thin tube to observe the tissue on a screen. After surgery, the hand and wrist will be bandaged or placed in a splint, and the patient will be allowed to go home after a short period of monitoring. An overnight stay is only required in rare cases. Since the procedure is performed on an outpatient basis, patients can usually go home on the same day it is carried out. After surgery, the wrist will likely be heavily bandaged or placed in a splint for about a week. Patients will have another appointment with their doctor to remove the splint or bandage. Most people then begin a physical therapy program with a physical therapist. It consists of motion exercises for the hand and wrist that are designed to speed up the healing process and strengthen the damaged body parts. Recovery periods vary from case to case and can be as short as a few days or stretch over several months. While carpal tunnel surgery is a standard procedure, several complications can occur in rare cases. Therefore, patients should consult their doctor if they experience redness, bleeding, swelling or other drainage from the injection site, fever or increased pain in their hands or wrists. What are the benefits of carpal tunnel syndrome surgery? Relief or elimination of wrist pain, increased or restored mobility, significant decrease of symptom severity, decreased numbness and tingling, stronger grip, better dexterity, and improvement in activities of daily livings. Carpal tunnel syndrome surgery in Germany. Germany is one of the leading destinations for high-quality medical travel. With numerous experts all over Germany and with the use of the latest technology, German medical care is truly outstanding. Carpal tunnel surgery is one of the most common surgical procedures performed on an outpatient basis in Germany, with around 400,000 surgeries every year. Minimally invasive techniques have greatly improved rehabilitation times and the level of post-operative pain and discomfort, which makes the procedure a popular and well-trusted choice in German hospitals and clinics. Complication rates are very low, and minimally invasive therapies make carpal tunnel surgery a viable option for elderly patients as well. Moreover, patients can use their hands almost immediately after the procedure, which allows a greater independence in general. A careful and thorough pre-planning of the surgery and your rehabilitation program is important and done in all German clinics, which are subject to very strict transparency and quality assurance mechanisms.